Okay, so for example, can everybody see my picture? Yes, nod head. Yes, yes, yes. Okay, thank you. Okay, so this is Piaget. And again, you know, you can read it in any of the textbooks. You can do however you choose to do it, but this is his theory. Okay, Piaget is a cognitive developmental theorist. Words like schema, that's your brain, how your schema developed. Okay, so sensory motor. So I teach you the stages always SPCF. So sensory motor, preoperational, concrete, and formal. But that's not enough. Okay, and even if you know the ages that happened, that's still not enough about Piaget to pass this test. Okay, and the test is, again, it's not going to give you Piaget. You're just going to have to recognize the terms. So Piaget had developmental stages in all of these stages. So I just mentioned egocentrism. What stage does that develop in? Anybody? You can type it. So egocentrism develops in the preoperational stage. Okay? Egocentrism is a term that means anytime you see a word that says centrism, center, that means the world centers around me. Centrism, centrifugal force. If you know it spins it around, everything goes toward the middle. Okay, that's me. So ethnocentrism means I believe the world is about me. Okay, so I'm sorry, egocentrism. I apologize. Ego. Okay, centrism. So that's the word. That's the key, and you would only know that if you knew the stages. So sensory motor is the first stage. That is the stages that where I learn about my five senses, sensory, motor. That's how I learn. That's how my schema, my brain begins to develop. Okay, so if you see schema, that's a Piaget word. I'm looking for developmental, cognitive developmental stages. Okay, in the sensory motor stage, that's that first stage, birth to two. In that stage, babies learn that thing with the ball and they look for the ball. What's that called? I see some lips moving. Object permanence, right? Okay, before 8 months, they don't have any idea. If they can't see you, you're gone. And most often, you'll see the game Peekaboo, right? They're playing Peekaboo with the baby, and suddenly, oh my gosh, they can't see you. Before 8 months, it's actually before 7. That's 7 months. They just think you're gone. So after that, they will begin to maybe throw the ball off the table onto the floor because they'll know you'll pick it up. Okay, so the question might say, you know, the baby throws the ball. The baby throws the ball off the table several times, watching mom pick it up. What has developed? Okay, so that is that they're in that object permanence. They've learned that that object is still there. So that's that's what happens in that stage. Sensory motor, I'm learning to learn to see the world as my senses as well as I motor around. And you know that age they're beginning to crawl and walk and talk, put everything in their mouth. Yes, all those senses. That's how they're learning their cognitions. So words like that are things that you really need to make sure that you understand, not just to memorize his stages, but to really get what happens in those stages. Okay. So I'll just go over the rest of them. So sensory motor, again, that's birth 2. In that age, they're beginning to see the world, to learn the world. If you've had kids, my oldest one is 28, and I remember being in the mall one day, and I looked down, and he had like a nasty cigarette butt in his mouth, like right. That's how they learn the world. And you know the little one, especially, everything in the mouth, everything in the mouth. Okay. So my little one, my middle one, her dad used to say, "Does that say touch me?" Because she was touching everything. I don't think we had decorations on the Christmas tree on the bottom until they were like 6 or 7. And they could reach, they would touch. Okay, so my pre-operational, like I said, that is my 2 to 7. They are extremely egocentric. Okay, That means it's all about me. When they're two, they'll end up with a toy that wasn't theirs. You take them to the mall, you take them to the friend's house. This is all pre-COVID, right? And they didn't come in with that toy, but as they leave with that toy, they're going to swear up and down it's theirs. The concept of that toy does not belong to them, does not exist. Okay, egocentrism. It's all about me. A child who's studying, the mother complains that the younger brother keeps making noise while the older brother is trying to do homework. Because the little one doesn't get it. In his mind, there's nobody in this world but him. Okay? So what also happens in that stage is symbolic play. They know symbols. So they love the toy vacuum cleaner, they love the babies, all that good stuff, okay? That's that symbolic play. That's exactly what happens at that age. Now, not my children, but some people's children, you know, the big M in the sky, you know, if you pass it, they're screaming, yelling because you take them to McDonald's often. Okay, maybe that was my children. But yeah, they learned the big old M in the sky, right? They learned that early. They can't read. They don't know what McDonald's says. And most often it's that Happy Meal toy they really want. Okay, so that's symbolism. All that happens in that stage. Okay, so I will put links here. So I do warn you, if you're not well versed, don't just Google. Okay, so make sure if you're going to use a picture looking for something and you Google, make sure it matches up with the book, okay? Because you don't want to learn anything that's not consistent with the text. Okay, and then of course that is my lovely concrete stage. I always think concrete, they're very solid, right? Okay, they get that 2 and 2 are 4, 3 and 3 is 3 and 3 is what? 3 times 3 is 3 is 6, and 3 times 3 is 9. They get that. They get that. Okay. They also begin to have logical reasoning. Okay, so they can understand logically. Oh wow, I'm sneezing. The cat's in the room. I sneeze. It must be the cat. They can also reverse that. They can take that back and reverse it. They understand that hey, this the cat is oh, here comes the cat. I better leave because now I've learned what I've learned and I can take it back and I can reverse it. So those are all terms that things understand. Reversibility. One of the things that they don't get is they don't get the concept of abstract thinking. Okay, they're very, very concrete thinkers. Okay, when my middle one was little, you know, she'd always say, "Where you're going, Mom?" And I'd say, "I'm going to go crazy." And she, "Oh, can I go to crazy too?" Very, very concrete. That abstract thinking is just not there. Okay. So then making sure that kids, a question I've seen, a 82-year-old man has a stroke. His doctor is talking to him and ask him to explain people who live in glass houses should not throw stones. When he explains it, he says, I guess I shouldn't throw a stone if I lived in a glass house. Okay, so what stage is he in? He's in the concrete stage because he didn't get it. You know, what it means, of course, is, you know, let's not throw stuff at other people when, you know, take a look at ourselves, right? But he didn't get it. So, and yes, he was 82 and he'd had a stroke, so he'd gone back to the concrete stage. So that's why you have to get the stages. Okay. So SPCF, great way to remember them, but you have to remember what happens in all those stages as well. So that was one of the biggest things I've heard, is just really making sure that you understand the terms. Okay, so and those are pretty heavy on the theorist areas, right? Knowing who the theorists were and how to answer those questions. So be sure that you get not only who they are, and then what they believe in. One of the other terms that comes with Piaget is accommodations and assimilation and accommodation. Okay, and those are the same words that we use when it comes to culture sometimes. Remember assimilation? if the question is talking about Piaget or we're talking about anything concrete, then what I know is that it has to be, that's a thinking thing, okay? So assimilation is things look very, very similar, okay? So when kids are little, they think that all four-legged animals are cats or dogs, right? They're furry and they've got 4 legs. It must always be the same. Or all cats are female and all dogs are male. So then they look very similar. That's assimilation. Okay, you've probably seen the question study guide. A little boy says, "Mom, look at that fat lady. She looks, look at that lady." No, that's a fat lady in the store. This boy says, "Look, a whale," right? Because he's similar, this large lady and this whale. And then mother says, "No, sweetie, that is a whale. Those are animals, and she is a human." Okay, so knowing that assimilation is in their brain, they have begun to assimilate because it looks like that, and then accommodation, making sure that now he's made room for the new information. Okay, so that's something I really want to emphasize is when you're studying those stages to know them, know them, know them, know them. Freud, Piaget, Erikson. And Erikson has 8 stages, and knowing those 8 stages, you'll get quite a few of those, understanding what the 8 stages are. Okay, so let's see here. I'll give you my big ones here. And again, these are my developmental people. So developmental theorists are people who looked at, they came from the child's viewpoint of how development happened. Okay, and we have tons of those. So Piaget. Who else? Give me some names, guys. Thanks. Erikson. Got it. Freud. A little Kohlberg is usually in there. He is my moral development guy. Okay. So those are just, know my big guys, they're not looking for those obscure facts. Okay. You might get a couple of those, but they're not trying to trick you. I promise you, despite what you think, they're not trying to trick you. You just have to know the stuff. Okay. Something else that I don't normally teach, and I've read it in the literature, I've read it in the study material, and it may be a test question because some of those things that we've never seen before are test questions. Okay. Okay. So the wellness wheel was on there. And I don't know, again, I haven't, this is the first time I've had anyone tell me that that was on the test. So the reason that there's 20 extra questions anyway is so you know that those tests will eventually, those questions will be on the test eventually. They are being marketed, tested, normed. Normed means that that's a statistical term, that's a research term. We're seeing how people do on those. So if it's not on there now, it doesn't mean it won't be on there in the future. So let's make sure that we kind of really know that one. That's our wellness wheel. Has anybody seen this in other places? Okay. So the wellness wheel really is looking at all the areas of it's important for us to be happy and healthy. I'll make it bigger for you. Okay, so there's 7 areas: your spiritual area, your emotional area, intellectual, physical, social, environmental, and financial. Okay, so in order for us to be healthy, the concern is that we are healthy in all areas. Okay, so we always talk about, you know, the importance of getting my degree, getting my licensure, all that good stuff. Okay, but you know, if you're not physically healthy, then a lot of those things are much, much harder. And I think that we've all learned with COVID how important it is to have people on our side, in our circle, right? We've had to, learn from home and be at home and keep our circle much smaller. But I think we've really valued that circle a lot more than we did before. Your environment, that's your surroundings, okay? If you're coming home to your place being a hot mess, it's hard to be happy, right? It's hard to, for me at least, it's hard to focus when I'm thinking, oh my gosh, I can see the dust bunnies in the corner over there. Okay, so all of those things are really, really important. So it is I'm pretty sure that, what's his name talks about it. I'll give you another one. Rosenberg talks about it, but I've never put a lot of emphasis on it. So I just want to make sure you're aware of that. That one really seems to be on there now. Okay, that's a health question. I'm going to put that in the box as well. Okay. Again, just want to kind of give you some things on there that I normally don't teach, and I'm making sure that I add to my repertoire. Okay, we're going to go to some questions. I want to talk to you about how to answer the questions also, okay, because that seems to be a really big deal of not understanding what they're asking or how to actually answer the questions. So let me just kind of give you some hints here, and we'll actually then go to some questions. Okay, so one of the things that I really want you to understand is what the question is asking me. Sometimes my students get lost in not even understanding what the question's asking me. Okay, so if you're tutored with me, the first thing I'll say to you is, what are they asking me? Sometimes I'm thinking in my mind, what are they testing me for? What do they want me to know? Right? Okay, this is the test has got several domains, and you know that the test is going to be in one of those domains. While it may be a code of ethics question as well as a human behavior question, what are they asking me, right? So that's the first thing, is understanding what the question is asking you. And if that means, so everybody's got several test strategies. Some people read the questions, the answers first, and then come back to the question. And if you have a way that works well for you, I'm not trying to change that. I just suggest that you really read the question first. Because in your mind, then, you should have some sort of idea what the answer might be just based on the question, right? So I want to get that, and then I'm going to go look for the answers. But I really want to get that I understand the question, and especially if it's a not question, right? Or the least. Go back, read it, because those are difficult. Okay, so fully read the question, understand it. Answer it in your mind first. Okay, eliminate the wrong answers. Most often there are 4 choices, and I can figure out 2 of those don't make any sense. And sometimes only one of them. Sometimes one of them doesn't make any sense whatsoever. Okay? And that's the one that can't be it. Okay? Has nothing to do with the question. So then I'm going to eliminate usually it's the 2 that I can't take out. Okay? Then there's 2 down there. When I have 2 left, I'm going back to the question. I'm going back to the question to look for the keywords in the question that helps me find out what that might be. Okay, so how can I prove it in the question? That's often what I'm looking for. Proof in the question of how I know that's the answer. So especially if it's a vignette and they're asking you which theorist to use, I'm going back. I'm like, how do I know? Where in the question do I see they're using a Gestalt term? How do I know this? Okay, so you're going to find there's not a lot of recall questions. The questions are usually based on what they are asking me. Okay, so again, read every answer option, answer the questions you know first. I'm a huge fan. I think those first 2 or 3 questions can make or break your game, right? I think when you first start the test, if 1 and 2 are like difficult, you're like, oh God, I can't do this, and it changes your whole view of the test. So go back and just skip them, flag them. I suggest sometimes you start at number 5, okay? Because once you get in the groove, then you're able to do what you need to do. So just be sure that you really kind of go over, skip those first 5 if there's something going on. Okay? Okay? Don't change your answers. Don't change your answers. Okay? If that's what you thought was the first time, do not go back in the end and go over them. No, 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 do not. Okay? On the questions, there's some all the above and none of the above. Those are not usually the right answers. Okay? Also, those keywords of all or none very rarely happen in the real world, right? So that's a big red flag. All of these are true. All people do this. There's one about culture. We should know all cultures? What? Can I know all cultures? And I'm pretty amazing. I'll be the first to admit. But how am I going to know all cultures? Those are signs I'm looking for. That cannot be the answer. And none. There's never a none. Okay? Okay? Those are my biggies. Okay? But what I'll say to you is if it's a first question or what should you do first, most often it's about gathering more information. Okay, what do you do first? So most often my first answer is not an intervention. It's going to be gathering as much information as I can, right? So how do I know? Or and I'll show you some practice questions, but if it's a first or what should you do, those are always going to be something that I need to probably gather more information. Okay? Keep in mind the Code of Ethics. If you haven't read them, you need to read them. You need to know them. If you ask me, that's the only part of the test you should ever have to study for is the Code of Ethics. I think that's the one part that goes with you forever. Okay, I have a lot of students who struggle with the Code of Ethics. I think I know them, and they get there, and they just don't. Is there a number value on what I can take from a client? Gift-wise, is there a number value? I can take $25, right? Yes, no, maybe? No, there is not. There is not. No, no, no. And that came from some really nice boss somewhere, some really nice agency director who said, oh yeah, why don't you try? No, that is not what it says. You need to know the Code of Ethics. And again, I think that's probably the most important thing for practice. That is the one thing that'll save your butt. Okay? So really, when you're in the real world, when you're in practice, you've got to know those. You've got to know. If you're seeing a couple in counseling together and the wife, they get divorced and the husband's attorney calls you and asks for a copy of the records, can I give them? I cannot. I cannot. Okay? A subpoena from the court is a birthday party invitation. It's rude to not say anything. I'm sorry, a subpoena from the attorney, a subpoena from the client's attorney. If her attorney subpoenaed you, okay, and they say, please share your records with us or please share your testimony, I'm going to say, oh, I'll check with my client, but I'm pretty sure we're not coming, right? RSVP, don't not respond. Okay, you do have the right to not respond. That is really okay. That's just not professional courtesy. Okay, so we're always gonna respond and just say no, thank you. Okay. However, if it's a subpoena from the court, that changes things, right? I'm not sure about you guys, but jail's not my thing. Just saying. And when I do go to jail, it'll be something I did. I got caught. Not gonna lie. Okay. So when it talks about a court order and what to do with those, it tells you exactly. Okay, here's my receiving gifts. Let's go there. Okay. Verbatim. A10F. Counselors understand the challenges of accepting gifts from clients and recognize that in some cultures, small gifts are tokens of respect and gratitude. When determining whether to accept a gift from a client, counselors take into account the therapeutic relationship, okay, how long have I been seeing this client, the monetary value of the gift, the client's motivation for the gift, and the counselor's motivation for the gift for me either wanting to accept it or decline it. Okay, so all of that you take into consideration, right? So as a rule, I don't take gifts, right? They know that you know that. It's the fine print they want you to know. So you've been seeing a client for, 30 years or, not 30 years, but you've been seeing a client for a very long time. Okay, and she invites you to, she gives you a small gift at Christmas. And sometimes they're very cultural. Okay, she's Hispanic, she's African American, she's something, she gives you a small gift at Christmas. I'm looking at why would I take the gift, why would I not take the gift, and then making sure that I don't hurt my client, especially when it comes to the area of food. Many people are very concerned because I may have food, I may eat something culturally different, and I'm offended if you don't try my food. Okay, so really, and again, I'm not saying eat the whatever in front of the person. I'm not saying you have to eat it. I'm just saying we have to be very, very careful that we just don't offend our client. Okay. So then, people often get bartering and receiving gifts mixed up. Is that the same thing? It is not. Bartering is pay. Okay. So
No.
counselors may barter only if the bartering does not result in exploitation or harm, if the client requests it, and if such arrangements are acceptable practice among professionals in the community. Counselors consider the cultural implications of bartering and discuss the relevant contracts with clients and document such agreements in a clear written contract. Okay? So basically what it says, especially if you live in a rural area and everybody takes chickens for payment, can you take chickens for payment? Yes. A rural area, that's what we do. Fine, not a problem. Okay? I can't let my, the guy who's a lawyer give me services in return of me treating him. No, that's not an option. It doesn't work that way. Not okay. Okay? So then, make sure that you understand those. You just can't do that. Let's see here. The whole issue with fees sometimes comes up. So make sure that you understand the issue of fees and how that works. Let's go over the court thing just real quick. So things like that are really important. The standards, the non-malfeasance, all those things, those are very much on there as well. Okay, here's the court. So B2D, when court ordered by a court to release confidential or privileged information without a client's consent. Okay, remember I've asked my client, right? And it doesn't matter what my client says. I'm showing up either way because it's a court. Counselors should seek to obtain written informed consent from the client to take steps to prohibit the disclosure or have it limited. What that means is I've gone to my client, I've said, I've got a court order and I have to show up for court. Would you please sign a release of information so I can say I don't want to share, and then I also want him to narrow the disclosure. Okay, to ask him to look at just a little bit. Don't look at the whole record, Your Honor. Just look at the little bit. Okay, because of the potential it may cause to my client. Okay, so B2E, to the extent possible, clients are informed before confidential information is disclosed and are involved in the disclosure decision-making process. When circumstances require the disclosure of confidential information, only essential information is needed. Okay, so again, I'm trying to get the court to just look at as little as you can, Your Honor. Please don't do this. This is privileged communication. That is only a legal term. It only means that it's confidential, but the only time on the test that it's correct is when it is a court issue. Okay, so I do not have to have my client's information to go to court. I don't have to have a release. Okay, I'm going to show up either way because if not, I'll go to jail. Okay, that's a bench warrant. That's a violation of court order. I'm going. Here I am, Your Honor. I'm going to do everything in my power to save my client, to protect the information. Okay, but I'm going to be there. I'm going to be there. Okay. Okay, just a couple of those, so make sure that you understand the code of ethics clearly. I had there were quite a few of these questions on there about your the purpose. I'm sorry, the 6 main purposes. Okay, not those. I'm sorry, your standards. Autonomy, non-malfeasance, benefice, justice, fidelity, veracity. Okay, I usually do a whole session on those, but be sure that you know them. Be sure that you understand what they mean. Okay, because it won't say what is non-malfeasance. It's going to use it in a question. It's going to use it in a question. It's going to say, hey, this is what it looks like. Okay, most of my students say that pocket prep is pretty similar to the test. Okay, that's kind of the vagueness that uses sometimes. Okay, anybody care to differ on that? Okay, we're going to do questions from a couple of places, and again, this is only about how to answer the questions today. So I'm not looking at a particular topic. I just want to know how we look at these questions. Okay, look at number 7. Okay. A counselor with several clients is adjusting to a difficult divorce. The counselor is not sleeping or eating well, is highly distractible, and is generally less in touch with her emotional state. The counselor should what? Okay, so first thing I'm going to go back to understand the question. Okay, she's got lots of clients, and she has gone through divorce herself, right? She's not sleeping well. She's highly distractible, and generally just like her emotional states, she's probably, you know, depending on where she's at in the stages of anger or of the stages of grief, denial, anger, bargaining, depression, or acceptance. So she's somewhere in there, right? Okay, so before I look at the answers, one of the things I do know is I have to protect my client. The questions are always about what is best for my client, not what's best for me. Okay, so I'm looking for a question that talks about how it's going to affect my client. Okay, continue to see the clients as regular as she could. I'm going to hold off on that one, right? Okay. B, discontinue client contact until she has adjusted to her new situation. That's not an option. I don't get to just stop seeing the clients because it's not good for me. Not an option. Okay, that's abandonment. I can't just, oh, well, you know what? My life got hard today, so I'm done. Sorry. Okay, seek psychological help for herself. Okay, that's a good answer, right? But the problem is it doesn't answer the question because the question talks about her client. Okay, so that's what I'm looking for, is about my client. Okay, so then you're right. It's D. Be alert to be alert to her mental status and be able to determine if continuing with her clients poses any threat of being detrimental to the counseling process. Okay, take care of me, but take care of my client first. So when you're looking at that, the first thing I thought is code of ethics. Okay, got to make sure that I do not abandon my client. And I want to take care of me, of course, right? But I can't just say adios amigos, I'm out of here. Okay, does that make more sense when you look at try to answering those questions? So I'm looking at the patient because that's what the code of ethics says, and I'm looking at all the other things, and I'm trying to figure out the best answer that answers that particular question. Because a lot of times answers are true, but does it answer that particular question? See the ones like this? Only one psychologist's developmental theory covers the entire lifespan. That's Erickson, but that wouldn't be on the test that way. That's way too easy. Okay, so knowing who it is, but that's not enough to know it. Okay, this one you might see. This is a Freud question, 21. Okay, and you might not even see the word Freud. Okay, if a client has a smoking habit, Sigmund Freud might say he is what? Okay, and no, it might not even say Freud in the question. It just might say a client who blah, blah, blah. So I have to know Freud's stages, right? Oral, anal, phallic, latency, and genital. And what Freud said was, if I get stuck in one of those phases, okay, then I'm spending the rest of my life trying to figure it out. Okay. OAPLG, old A people love gold is the one I usually use. Okay. I've had Orphan Annie, Pretty Little Girl. And yes, I have to know those stages. And yes, I have to know the order of those stages. Okay. But that's just not enough. So what I know is in that oral stage, Freud believed that, first of all, O, A, and P are all sexual stages. That he's a psychosexual development, and oral, anal, and phallic are all about sex. Okay, we're born with our id. Our id, in case you haven't heard my videos, is my pleasure principle. Oh, oh. Okay, my id is, I'm born with it. Freud said that we will not survive if it's not the id. Eat, sleep, and procreate. My instincts. Okay, so I'm born with my id. So then, as my ego develops, it doesn't do a lot of work yet. But in that oral stage, then my mother is breastfeeding me, right, or bottle feeding me, or whatever. And if she pulls the bottle out of my mouth too soon, then I'm stuck. I didn't finish that. I didn't satisfy that stage. So as an adult, I'm constantly putting things in my mouth. So a woman who is overweight, a man who drinks too much, any of those things is because I'm fixated, that's where you would see, or stuck in that oral stage. Okay? My anal stage, same thing. The anal stage says I was being potty trained, and I was potty trained too early. Okay? So I've learned to tighten my sphincter muscle. That's the one that helps you to have a bowel movement, tighten that sphincter muscle. And as a result, as an adult, I have a very tight sphincter muscle. What would that look like in an adult? We've sometimes heard the word tight.
That's OCD or something.
Got it. You got it. A little tight butt, tight wad. I've heard that, things like that. Okay, because according to Freud, you didn't get that. You got potty trained too soon. So your whole life now, your sphincter muscle is going to be stuck. Okay. So then that's what you're looking for. That's why you have to know them and then know what it looks like as an adult. Okay. And then your phallic, of course, that is your, that's when you start, that's any question on masturbation is about your phallic area. Okay. So phallic is, that's when girls and boys discover that fun thing between their legs. Like, oh yes, look what God gave me, right? Also, they begin to be attracted to the other spouse. I mean, yeah, the opposite parent. So the daughter, of course, is attracted to her father. The mother, of course, is attracted to, the boy is attracted to the mother. The name for the boy's stage, even though it starts with an O, it is Oedipus, right? Okay. And the girl's stage, it's going to be Electra. Okay. So Electra is the boys, and Electra is the girl, Oedipus is the boy. Okay. Any question about masturbation? A man who is 40 and he still with his mother and he's never had actual intercourse. He's stuck in that stage. Okay. So the phallic stage, two other things happen. Okay. So the boy, if you see a question, a 3-year-old is on his way to the emergency room because he has to have some surgery, and they're going to put the IV in his groin area. He's screaming. According to Freud, what's he afraid of? According to his unconscious, using psychodynamic theory, things like that, what is he afraid of? He's afraid of castration. He's afraid that his dad will find out and he will cut off his penis. Okay? Same thing with a little girl, but of course she's not afraid of her dad. She's just jealous of her dad. She has penis envy. She wishes she had a penis. So anything about sex, development about sex is Freud, or any of my other, you're looking for psychoanalytic, psychodynamic, those kind of terms, let you know who that belongs to. Okay? So again, they wouldn't be that simple on the test. Just want to kind of give you an idea of, you might see something like that one. That's a diagnostic question, 35. A patient arrives complaining of feeling restless. She describes mood swings and times of hopelessness, followed by periods of high energy and creativity in which she can go for days without sleep. Based on what you know, what is her diagnosis? So that one, I'm going straight back to the question. What do I see? How do I know it's that answer? Okay. So it says depressive disorder. So seeing things like that, it doesn't say major depression, right? So that could be anywhere on the scale of the end of depressive disorder. Okay, so watch the answers because sometimes they're trying to trick you. I wouldn't say that all the time, but yeah. Okay. So ADHD, I know, is my attention deficit hyperactivity disorder. ADHD, that is portrayed by touching, feeling, not being able to sit down, kids who are behind in school, things like that. Okay. So then, and my OCD, that is my obsessive compulsive disorder, of course. Okay, bipolar 1, bipolar 2, you know the difference between those. Bipolar 1 has 5 full days of a full-blown, 5 to 7 full days of a full-blown manic episode. You got it. Okay. Most often on the test, if they're talking about bipolar, it's going to be bipolar 1. Okay, but sometimes you'll get a diagnostic test where you'll really have to distinguish whether it's bipolar 1 or bipolar 2. Okay, bipolar 2 is characterized by having one, bipolar is hypomania, and in general for the test, hyper, H-Y-P-E-R, means more, H-Y-P-E-O, the hypo is less. And in real life too, that's just what it means. Okay, so hypersomnia is too much sleeping. Right? Hyper. So know those pronouns, I'm sorry, the prefixes that'll really help you in the test. So hypo is less. So less than regular bipolar. So a hypomanic episode is less than 4 days, and you really might not notice. Okay, you might not notice. They might be someone you've known for a long time, and you're like, wow, you know what? Every couple months, Pam's in a really good mood, right? I have to have at least one episode of the major depressive disorder, which is 2 weeks, 2 weeks of can't get out of bed, don't want to shower, insomnia, overeating, undereating, all of those things, 2 full weeks. Okay. And then we'll go to that the hypomanic episode. Okay. So then mania, I have to have at least 5 to 7 full days. And you will know if it's a manic episode. The client reports that she stole her brother's car. She slept with half the people in the neighborhood. She hasn't slept for 4 days. She's talking. It's called pressured speech. Okay, pressured speech is where you just like, okay, get everything out. I can't talk right now. I gotta break things down. That's like pressured speech. You'll see all of those things. Most often, a full-blown manic episode is going to end me up in the hospital or in jail. Okay, but you'll know the difference. You'll know in the test. So the other thing is cyclomania, of course. I'm sorry, cyclothymia. If you see the cyclothymia, that's my dark purple. The green is my average. But the cyclothymia is 2 years, 2 years of having those not normal highs and lows. See that? Some of them are higher, some of them are lower, but still not the same as most people. The medication of choice for bipolar is?
Lithium.
You got it. If lithium is not on the test, we're looking at a Tegretol or a Depakote. In the real world, we're trying to get away from lithium. I don't think the test has caught up with it yet, but if it doesn't say lithium, it's going to be one of my anti-seizures. Okay. Go someplace else. Just want to kind of give you some questions that close on some windows here. Anybody have any questions as I go along? So then, 154 is a pretty typical question. Do you know the Johari window? Yes, no, maybe so. Okay, I'm just going to keep talking. So my Johari window, and I actually have a YouTube video out on that if you want to go look at it. My Johari window, it is confusing. Kind of remember what goes where. Okay, so my Johari window says that I have 4 areas inside of me, which is really a lot like the archetypes that belong to Carl Jung, right? Okay, so what he said, and again, it's called Johari window. It's by these 2 people, but you wouldn't need to know their names. It's just called the Johari window. So what it says is inside of all of us, I have 4 quadrants. Okay, I have what is open. My open area is what is things I know about me and things you know about me, right? No secrets. I know it, you know it, out there. Okay. My blind area are things that I don't know about me. I always think about my blind area. Those are the areas that I really can't, the blind spot I can't see. You know, now I've got the fancy car that blinks, the blinker, so I know something's in my blind spot. But those are things that other people around me can see, but I cannot see. Okay. My hidden area is things that I know, but I'm not telling you. Okay. And then my unknown area, of course, are things that I don't know and you don't know. Okay. Any changes to any of these areas changes the quadrant, right? So if you tell me something about me, my blind area changes. If I suddenly realize something about myself that I didn't know, my unknown area gets smaller and then my open area gets bigger if I share it. Right? So that's what it looks like. And what's going to ask you is going to ask you about which quadrant sometimes it goes into. Okay? So the upper left quadrant is what is known to self and known to others. Okay? That's my, right? The upper and the back. So that's the upper left quadrant. The upper right is what is known to others, but unknown to self. Okay? Upper right. Okay? And then my lower left quadrant, that is what is known to self but not known to others. And then my lower, right, that's the lower left, lower right quadrant. Okay, so it's my upper left is the open area, right? Then my upper left, so upper right, after left is my, I forget my order. Upper left is my open area. Up to right is my blind area. Lower right is hidden. Lower left is unknown. Okay. I'll put that in your chat box. So sometimes those are, it's a question I'll ask you, like, where's it at? Okay. The goal of this, though, is to know that they're all, one change on any of them can change the whole box. Let's go back to that question. Okay. So now, okay. And remember, this is a not question. On the test, they are not highlighted. It is not a big, no, it's a not question, though. So I'm looking at not questions. I'm looking at 3 of those things are right. Which one is not true? Okay. So regarding the principle of change related to the Johari window, which pairings listed is not true? So remember, my upper left is what is known to self and others. Lower left, unknown to self and unknown to others. Okay, my upper right has to do with my my blind area, and my lower right, of course, then is my no one knows. Sorry, it looks like I got some Amazon packages today. Sorry. The answer to that one is D. Okay, So, A change in all quadrants affects all other quadrants. Denying, covering up, or ignoring behavior, it all requires energy. Okay, and that is an all question. Okay, but however, that is, yeah, that's an all question. And usually, I usually say all things aren't true, but that one is true. Okay. B, threats and mutual trust increase awareness. The smaller the upper left quadrant, right? The smaller that is, the poorer the communication, Okay, remember that smaller of left quadrant? That's my open area. The smaller that is, okay? Okay, so D is the answer to that one. We all confused? Well, yes, we understand fully now, Dr. Pam. Thank you. Well, great. Love the feedback. Okay. Look at number 163. Indecisive and indecisiveness and undecided. What's the difference? Okay. So here's my rationale, the way that I remember this one is, okay, so if I am undecided, then I really have no idea, right? No idea. If I'm undecided and I have a party to go to tonight, I am still at the mall. Oh my gosh, I don't know what to wear. I have no idea. I'm totally undecided. Indecisive means that I have choices. Okay, so indecisive is like, wow, you know what? Now I know which dress to wear. I'll wear this one. Okay, so indecisive means I have choices. Undecided means I have no idea whatsoever. Okay, so what was the answer to that one? It is B. Okay, I'm undecided. I'm out there trying to, make sure I can get the right party dress. I just don't know which one to get. Good, good, good. I'm gonna stay away from research just because it scares people, and it really shouldn't. It's not that hard. Look at 176. That is a diagnostic question. You'll get some of those as well. A couple presents for counseling. Evaluation reveals that the wife comes from a dysfunctional, neglectful, alcoholic home and has little trust or tolerance for relationships. Consequently, their marriage is marred by constant arguing and distrust. Frequent demands that he leave, episodes of impulsive violence, alternating with brief periods of excessive overvaluation, stating that he is the best thing that ever happened to her or too good to her, etc. What is the most likely diagnosis?
B.
Prove it to me in the question. Prove it to me in the question. What words do you see? Okay, so I'm going to go over them with you, and you should know your personality disorders. Remember that if you're old enough to know, they used to be on Axis 2. Personality disorders do not come for treatment. They're never coming. They don't come because they don't have a problem. That term is ego-syntonic. It's in sync with who they are. Okay, all personality disorders, as well as all of my all personality disorders, as well as my anorexia. Anorexia, they always think that they're too fat. Always. I wonder why they weigh 3 pounds, okay? So then, my antisocial, one more thing. You do not diagnose them until they're adults, except for borderlines, okay? So we do not diagnose any personality disorder until they're an adult. So one of the reasons that I know it's a personality disorder is because it talks about coming from a dysfunctional home, neglectful home, and little trust for relationships. So if it didn't give me all personality disorders, that would give me a clue, because it's been this way since childhood. That's a personality disorder. Okay. Antisocial, they are very friendly. Don't think they're not a social, because they love you. They will invite you to their house. They will cook for you, and then they will kill you and blame you. Okay. Those are the word for sociopaths. So antisocial, if you've seen it on TV, it's because they're not counselors. Okay. Antisocials are people who really just don't like you. I mean, they're nice, they're kind. Remember, like, Ted, what's his name? Ted Bundy in Florida, when he was like, he invited the girls to his car. He was charming, blah, 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 and he killed them, right? My conduct disorders, untreated, grow up to be my antisocials. Okay. My histrionics, I say to my women, if you don't know a histrionic in your friend group, you better check the mirror, because somebody's histrionic in that group. We always got one in our girl group. There we go. Look at me, world. I am here. Ha ha. Got on my tight skirt and my high heels. Got my eyelashes on. Yes, look at me. And I'm just going to McDonald's. Okay. Histrionics. Me. They're not necessarily promiscuous. They like to flirt. They like the center of attention, but they're not necessarily promiscuous. Okay? Those are my histrionics. For the test, not in the real world, for the test, histrionics are always women and my narcissists are always men. Okay? My narcissists walk into a party and they're like, oh, you are so lucky to breathe my air. Look at you. You see a question where he's telling the therapist, you get into therapy because they're not coming, and he's telling her, I've taken care of my wife. I bought her this, I bought her that, I bought her this. Oh my gosh, she should be lucky to be married to me, right? Those are, again, not in the real world, but for the test, that's going to be my narcissist. Okay. In truth, narcissists have low self-esteem, but they come across as very much in control, and how lucky you are to be in their presence. My histrionic, she's going to come in the party and like, yeah, girl, I'm here. Party just started, right? Okay. So my borderlines, that's the answer to that one. My borderlines are the ones who love you, and hate you. Okay. So they'll come into your office and, oh my gosh, I have seen 17 therapists and you're the very best one. I love you. You've made my life so great. Thank you. Okay, and then she'll leave after a couple of visits. If you get one to stick around, you're very lucky, because most often they don't. So then that makes her what is she? She's borderline. 1 minute is the best thing that ever happened to her. Okay, inconsistent relationships, constant arguing, emotions totally out of control. Okay, very black, very white. Sometimes you'll see the word splitting. That is my borderline. If you've ever been in a room with somebody, or if you've ever been in therapy with a client, and after 15, 20 minutes, you feel crazy, it's them. Okay? Very black, very white. Love you, hate you. Okay? So again, ego-syntonic. Now, my borderline actually, though, does have its own special treatment. So what is the treatment now? Evidence-based treatment that we use? Yes, DBT. You got my bell. I don't think I've rang it all night. Yes. DBT. So DBT is where we got mindfulness from, right? Okay, it's dialectic behavioral therapy. If you went to school, like, I don't know, like I did 1.5 million years ago, this didn't exist. Okay, it's one of our newer theories. Okay, DBT not only works well with my borderline personality, but it also works well with children. I've seen a lot of agencies who use it with children because it really helps them learn to regulate their moods. So it's mindfulness. It's learning to be in the moment, enjoy the moment, just be in the moment. Your emotional regulation, okay? Learn to sit with the emotion. So a lot of my borderlines, a lot of kids, when I feel uncomfortable, I want to run. I want to get out. I want to do something because I can't sit with this feeling. I don't know what to do. I'm cutting. I'm yelling, screaming. So it teaches you just sit with that feeling, okay? Regulate those emotions. The world is not going to come to an end because he didn't call you back. Okay? And then interpersonal effectiveness, learning to have and hold and maintain relationships. Okay? Those are my borderlines, and this is DBT, how we learn to treat this. The modality of choice for treating it. Okay, so one of the things I tell my clients who are testing shortly is I really think that mindfulness is important. I remember taking my test, and really I took it like 30 years ago. I took it in 91. Wow, yes, 91. Okay, and I remember this long time ago, and whenever we had the pencil and paper test back then, you had to wait 6 weeks for it to come back. I know. We had no, it was like, yeah. So, but I remember sitting in the room thinking, this is the moment that I've dreamed of. This is what I've wanted my whole life. And pass or fail, I just wanted to be mindful in the moment. And of course, that wasn't a term then. We hadn't coined it mindfulness yet. But I just remember just wanted to know, just how I wanted to remember it. I wanted to be thankful for the moment and to enjoy the moment. Okay, so that is my DBT. Okay, let's pick up a few more. Lots of these seem to be on there. Lots of those family type questions. Look at that one, 178. I'm gonna say, prove it to me in the question.